We are going to upload the second video regarding MCS entrance preparation, my friends. So we continue, okay, from paper 11. 8th AGCC 2017 TNM classification of pancreas. TIS carcinoma in situ. T1 tumor limited to pancreas up to 2 cm in gray dimension. T1A tumor less or equals to 0.5 cm in gray dimension. T1B tumor more than 5 cm, more than 0.5 cm but less or equals to 1 cm in gray dimension. TIC tumor more than 1 cm but less or equals to 2 cm in gray dimension. T2 tumor limited to pancreas more than 2 to 4 cm in gray dimension, and T3 tumor is more than 4 cm in gray dimension. T4 tumor involves celiac axis, superior mesenteric artery and or common hepatic artery, and 1 meta in 1 to 3 regional lymph node, and 2 meta in 4 or more lymph nodes. M1 is distant metastasis. Stage O is TIS and OMO. Stage 1A T1 and not M node. Stage 1B T2 and not M node. Stage 2A T3 and not M node. Stage 2B is T1 to 3 and not N1 M node. Stage 3 T1 to 3 and 2 M node. T4 and any M node. Stage 4 any T any N M1. Okay. This is 11. Now 12. Let's go for this one. I guess the writing is not very clear. It's dim, right? Okay. Let's try to read. Boko formula is used to accurately determine burn size in children. Urine output is 0.5 to 1 ml per kg per hour. Most common cause of death at site of burn is asphyxia, death in burn, septicemia, early death in burn is hypovolemic shock. Late death in burn is septicemia, sepsis burn by Pseudomonas. Barco formula for burn size estimation: height 0 to 1 year 19, 1 to 4 year 17, 5 to 9 year 13. Neck 4 0 to 1, 1 to 4 and 5 to 9, 2 to 2. Anterior trunk 13 13 13 for age, and posterior trunk 13 13 13 for age as well. A child has burn circumference both thighs 13, buttocks 2.5 plus 2.5 equals 5, and face and scalp with hairs equal 17. Local flaps. Plastic surgery. Transposition flap. Most basic design. Z-plastic for lengthening scars or tissues. Rhomboid flap for a cheek, temple, back, and a flat surface. Rotation flap for convex surfaces. Advancement flap for flexor surfaces. VY advancement used for fingertips and extremities. Ballot flap for convex surface, especially nose. And bipedical flap is for eyelids, rarely elsewhere. Now, page 13. Next one. Okay. We have planned to finish up to 20. Okay. Lymphatic system. Okay, now it's clear, I guess. Yeah. Secondary lymphedema. Filariasis is most common cause worldwide. Familial version of lymphedema is precox mixed disease, viviparous nematode, which rarely bankruptcy, whose only host is man, is responsible for 90% of cases spread by culex. Kikuchi disease is painful, tender lymphadenopathy, most commonly involving cervical lymph node. Peasant chest has another name, PEC2. Pneumothorax, trauma, MC, most common. Tumor, tuberculosis, etiology of anaerobic. Liver abscesses, aspiration, anaerobic bacteria, I guess. Let's make it clear. Anaerobic bacteria, that's right. Okay. Chest x-ray, patchy pulmonary infiltration, snowstorm appearance, fat embolism syndrome. Most common visceral malignancy and leading cause of death is carcinoma lung. Integrated PET CT scan is the most imaging modality of lungs. Most common primary cardiac tumor is big tumor. Most common malignant tumor of heart in adults is angiosarcoma. And cervical contractures are major problems of in burns involving chest, neck, and face. Okay, let me see 1, 2, 3, 4. We're going to go for another page, that is page 14. Autosomal dominant. Yeah. Okay, keep it over here to make it to see it clearly. Autosomal dominant, SNPCC, FAP, BRCA, 1, 2, Marfan syndrome, hereditary spherocytosis, adult polycystic kidney disease, Huntington's chorea, acute, intermittent porphyria, osteogenesis imperfecta, von Willebrand's disease, myotonic dystrophy, neurofibromatosis, tuberous sclerosis, autospongiosis, or achondroplasia. Autosomal recessive albinism, Wilson's disease, hemochromatosis, sickle cell anemia, beta thalassemia, cystic fibrosis, hereditary emphysema, homocystinuria, Friedreich's ataxia, phenylketonuria, Fanconi syndrome, Wasser's disease, X-linked disorders, hemophilia A recessive, G6PD deficiency, Duchenne-Berger muscular dystrophy, hypophosphatemic, rickets dominant, fragile X syndrome, color blindness. We're going to go for page number page 15. 51. Okay. Half is going to be done. In children, maintenance fluid, dextrose, zinc, burn. Okay, Parkland formula, 4 ml per kg percent TBSA volume, burn. Okay, crystalloid volume, Brooks, and I can't. Fresh water, 2 liter, 1.5 ml per kg per TBSA burn plus colloid, 0.5 ml per kg percentage TBSA. Galvestone, 5000 ml per meter square burned area, 1500 ml per meter square total area. Most common cause of death in burns is septicemia at the site of asphyxia. ADS is a neurosurgical emergency. Normal pressure, hydrocephalus, NPH, abnormal gait, dementia, urinary urgency, triple S therapy of subarachnoid hemorrhage, hypervolemia, hypertension, hypertension. Dexamethasone reduces peritumoral edema. Most common suprasellar mass in children, adults, craniopharyngioma, pituitary adenoma, respectively. Most common gene mutating carcinoma, oral cavities, P53, 80% of salivary gland stone in submandibular gland. Another page, 16. Sorry, it was like a tired voice sighing, something like that. Okay, I hope my friends will forgive me for that. I couldn't focus on study that time. Filariasis, most common cause of lymphedema in worldwide. Buffalo hump contour of ankle is lost. A buffalo hump forms on the dorsum of the foot. The square toes. Toes become a square, cause of confinement of footwear. The stimulus dorsum skin can't be pinched because of subcutaneous fibrosis. Mediastinal masses most common anterior thymoma, most common middle cyst, most common posterior neurogenic tumors, most common neurogenic tumors, most seen in all three compartments of mediastinum, lymphedema, bronchogenic cyst, and mesenchymal tumors. IOC for diagnosis of CT, IOC for diagnosis of neurogenic tumors, MRI, pectus excavatum. Most common chest wall deformity, pectus carinatum is pigeon chest. Lung abscess due to SRS, vancomycin, pulmonary embolism is features of acute right heart strain, acute right axis deviation, P pulmonale, R-BB, inverted T waves, and highly predictive of PE, SQ3, T3 seen in less than 12% patients. We are going to go for page 17. Classification of intestinal atresia type 1, membranous atresia with intact bowel tumor. Type 2, blind and separated by a fibrous cora. Type 3, separated by V-shaped mesenteric defect. Type 3b, apple peel atresia or Christmas tree atresia. Type 4, multiple atresias, string of sausages. Treatment of colon cancer according to stage O, TIS, and OMO, endoscopic polypectomy. Stage 1, T1, M0, malignant polyp, segmental colectomy. Stage 2 and 3, T1 to 3, M0, localized colon carcinoma, surgical resection. Stage 3, TNE, M0, lymph node metastasis, surgical resection plus adjuvant chemotherapy. Routinely, reference regimen, Folfox, IV, 5-FU, leucovorin, oxaliplatin. Stage 4, TNE, NNE, M1, distant metastasis. Most common site of metastasis, liver more than lungs. Resection of isolated resectable meta plus ADC chemo palliation for unresectable disease. Should be 17. Okay, 17 is done. Now we are going to go for 18. Enzyme elevated in cholestasis ALP5 nucleotidase gamma glutamyl transpeptidase MELD score 3.8 log E as bilirubin mg per deciliter plus 11.2 log E INR plus 9.6 log E as creatinine mg per deciliter. MELD score is for prioritizing allocation of liver transplant. PELD score NAVIA 1 is nutritional status, 2 is 3 bilirubin, 4 INR, and 5 albumin. Radiological grading of varices, grade 1. Straight varices seen only on inspiration, grade 2. Straight varices, all phases of respiration. Stage 3, tertius varices in lower half of esophagus. Stage 4 is tertius varices in entire esophagus. Gallbladder curvature sign, palpable, non-tender, CB, caused by distal common duct obstruction secondary to peripancreation. pancreatic, freezing cap is most common anomaly of gallbladder created by infolding of septum between body and fundus. Gallbladder functions normally not an indication for cholecystectomy. Moynihan's hump is most dangerous anomaly. Right hepatic artery takes a tersus turn. So 16, now 17, 18 is done. Now we are going to go for 19. Fucose nose, left supraclavicular, cloacate node, femoral canal node, lymph node outline, cystic lymph node, Krauss lymph node, jugular fossa lymph node, Williano node is sentinel lymph node in carcinoma breast. Enucleation is treatment of choice in hemangioma liver, lymphoma esophagus, lymphatic cyst, insulinoma involving pancreas. Important triads, okay. Virchow's triad is hypercoagulability plus stasis plus end injury. Cushing's triad, intracranial high, increased BP, bradycardia, and decreased R. What? I have to look at it. RR, respiratory rate. Quincke's triad is hemophilia, GI hemorrhage plus biliary colic plus jaundice. Borchards triad is gastric valvulocytical EP, pain plus inability to vomit, inability to pass, and the tube. Regular triad is gallstone, ileus, small bowel obstruction plus pneumobilia, ectopic gallstone. So it is 18 is done, right? We are going to go for 19, okay? And making notes and reading them and recordings. They are not easy things, as I feel. Okay, now we are going to go for classification of gallbladder carcinoma, which is very important. T1A, lamina propria invasion. T1B, muscular invasion. T2, invade the perimuscular connective tissue. T2, invade the perimuscular connective tissue on the peritoneal side with no extension to cirrhosis. T2B, invade the perimuscular connective tissue on the hepatic side with no extension into the liver. T3, cirrhosis perforation or direct invasion of the liver or invasion to any other single extrahepatic organ. T4, tumor invades mainly portal vein, hepatic artery, or two or more extrahepatic organ. And on meta to 1, 2, 3 regional nodes and to meta 4 or more lymph node. M1 distance meta stage 1A, T1A and not M node stage 1B, T1B and not M what? Let me see. Oh, M is not very clear here. Okay, stage 2A, T2A and not M not, stage 2B, T2B and not M not, stage 3A, T3 and not M not, stage 3B, T1 to 3 and 1 M not, stage 4A, T4 and not to 1 M not, and 4B is TNA and 2 M not, or TNA and NA M1. M for metastasis. Yeah, okay, so is it okay, pull and find out. Last, okay, 20th page. Most common cause of thrombophilia, most common congenital cause of venous thrombosis, most common factor V later is called, okay. So most common congenital cause of venous thrombosis and most common genetic heredity, blood coagulation disorder, lung function, lung infarction is rare because of dual blood supply, bronchial and pulmonary arteries. Inverted sampan bowel leg and varicose veins. Patients with acute symptomatic primary ASVT may be candidates for catheter-directed thrombolytic therapy. I guess it's written. I've written very small letters, so even I can't recognize sometimes. Sclerosants used to treat DVT is 0.5 ml. Perforators location in CVD. Hunters below medial malleus. Inframalleolar perforators in medial cuff. Coquet's perforators just below knee. Board's perforators above knee. Dod's perforators at the level of adductor canal, and Tilrian perforators. Delayed venous refilling is Harvey's sign. On standing, arterial BP rises by 80 to 100 mmHg. Okay, I will see you guys in third video. I mean to say next video from 21 to 30 notes, and all the best for MCS entrance preparation and MS Specialization registration in Nepal. Okay, have a good day, guys.